everyone, I'm Dr. Preeti Poghe and today we are going to talk about empathy. Now, what is empathy? Empathy is being in other person's shoes and how to be in other person's shoes if you have not been in the situation before. So you should know the importance, you should understand the seriousness of the problem, and also you have to use few sentences, some ways to show that you are empathetic. That means you understand the other person's situation. Now that is impossible by without expressions. So you have to use these sentences with expressions, right facial expressions, right tone of your voice, and use appropriate hand gestures. Your position should be right. So everything together shows empathy. So but I'm going to give you some 5 sentences so that things become easy for you when you go and sit in your part 3 stations with your role players. Either it can be a angry patient station or it could be a breaking bad news station. These sentences will help you there. Right? So if you use these sentences in the right way, you can easily pass the communication skills domain. So what, as we said, is empathy? It has to be something between showing sympathy and being practical and professional. Right? So if you have an angry patient and the patient has just come inside, or the role player has just come inside and has just bursted out, and you don't understand the situation well, or the person has already given you his or her part of story, and to make a gist of it and start your part of communication, you can start with, if I understand correctly. This not only puts you in the position of supporting by your own self. When you say I, that means you are involving yourself into the communication and you're putting your own emotions into it, but it also makes the other person understand that both of you are on the same page. The second sentence is, I would feel the same in that situation. This could apply to any of the situations. Either the role player is angry, frustrated, upset, sad, anything. So maybe this person is not on your side, is actually blaming you for something that has happened which you are not responsible for. But when you say that, it actually makes the person understand that the situation that the person is in, that the role player is in, is completely understandable, so that the other person, the role player, also understands that when you are giving this sentence, it actually means that you are going to also give him some solution or some advice to handle this situation. And if there is an angry patient, the patient will calm down. If the patient is sad, the patient will open up more with the sentence. Well, the third sentence I would suggest is, I'm sorry, you have to deal with this. This sentence can generally be used when the situations are not very easy, they are becoming worse, and the person is really sad or in a very difficult stage, or there is some mishap or some mistake from the institutional level or from your side. Okay, so in these cases, this sentence, I'm sorry, it involves not only apology, but also along with that it empathizes with the patient. And if there is any problem with the institutional level, it also means that it doesn't happen regularly with the institution. So it's only you that you have to deal with this. You're few of the some patients who have to deal with this, and generally doesn't happen. Such events are rare in the hospital. So if this sentence is used, it can generally cover the whole of the situation. I'm sorry, you have to deal with this. Or when when you're expressing your empathy after breaking a bad news and the patient is really upset, this sentence can really be soothing. Try and use this. Well, the fourth sentence is, I can't even imagine how difficult it must be for you. Or, I can't even imagine how you're holding this, because this must be a very difficult situation to be in. So this is a very useful sentence when it is used correctly with correct expression and voice tone when you are breaking a bad news or someone who is really going through the end stage of life, or someone who has really lost someone recently, right? So all these situations, in all these stations, if this sentence is used correctly, you can really score very well. Plus you can feel that it also not only adds to marks to your station, it also adds to your persona on how to deal with the situations on daily basis when you are into practice. And the last sentence I would suggest today is something which is the a sentence, that is, you are right. When you say that, you are right, this is the sentence that can calm anyone down. When you have a very angry patient, a patient who has already had been through a big problem, or there is some mistake from the institution or from the doctor's side, or there is some problem with the communication, or the patient has been waiting for a very long time, and the role player wants to make you understand that it is difficult to sit for 2 or 3 hours in the reception waiting for the doctor when the person is in pain. And when you start your communication saying you are right, this not only means that you understand that the problem of the person is right, and it's not something that the person is blabbering about or making it look very big. But when you say you are right, it means that the problem of the person is actual, and however the person is reacting is understandable. So try and use these 5 sentences in your stations and see how it works. Let me know if you score very well, and let me know if this video has helped you. Thank you very much.